concern I have is about getting back to normal, meeting people again. Is it going to be harder for the worry of catching anything again? Is it going to be gone? I think about it all the time.
My main concern would be my level of fitness now at home. I've been in since last March. I already have health issues, so I was never very fit to begin with. But now I actually feel, how am I ever going to get any form of fitness back at all when I can barely walk?
My concern with living with obesity is motivation to get out for walks at the moment. I'm finding it very difficult with the weather, and but I do have one motivation, because I went for a walk the other day, and there was a gap in the wall that I used to be able to get through, and now I'm able to get through it. So I'm very pleased with that. But just motivation in general, trying to get out, I find it very hard.
My concerns is aftercare. We have been doing not face-to-face meetings. So when this is all over, being able to do face-to-face again.
Hi, my name is Kathy. I'm a dietitian working in the weight management service in Loughlinstown. I wanted to respond to some of the queries that Bernadette and Bernie and Mary Frances raised about the challenges of support services and providing aftercare and getting help for patients during COVID. So I just wanted to say that certainly in the weight management service in Loughlinstown, the staff are still working. We can't see people in the same way as before, so we have a limited number of face-to-face appointments every day, and we try to triage those spaces for people who we really need to see physically on site. But apart from that, we have telephone and email support options. One of the very few silver linings of COVID has been that we can now do video consultations, and we're getting really good feedback from patients who find that it's similar, or as similar as it can be, to a face-to-face appointment when you're discussing some topics in the current circumstances.
My concerns would be mental health and how to cope with it after COVID and now, basically.
If you find that your mental health is challenged, then talking to your GP or looking at the resources like yourmentalhealth.ie to see what you can do to take care of yourself and your mental health while you're waiting.
My concern is swimming pools being closed. I'm not getting exercise, and hopefully that I can get back to where I was. It's going to take a long time to undo the damage this COVID has done to me.
It doesn't have to be strenuous exercise. So people sometimes would say, I used to go swimming and that was good exercise, but I can't do that anymore. So now what can I do instead? Anything that gets you out of the chair or out of the house is a good thing. If that's walking up and down the street that you live on or walking around your back garden a few times, that's okay.
Hi, my name is Ben, and since having a significant weight loss, I was maintaining my weight by going to the gym. However, the gyms are now closed due to the level 5 restrictions. I now go walking most days for 10 to 11 kilometers. During 2020, I recorded over 6 million steps on my Fitbit, but I've still gained over 5 kilograms in the year.
It isn't just you do so much movement and you burn so much calories. The body is so clever at finding ways to make movement cost you less through fitness and muscle physiology and really clever tricks like that. And it turns out as well that if you do use a lot of energy through moving, it kind of clips it off other bits from even things like your immune and reproductive systems. So it's a really clever machine that we inhabit, and if it wants to gain weight, it's quite a fight for that to prevent that. So I suppose the broader concepts are managing best weight, and we do know big interventions like weight loss surgery will generally get the population down about 25 or 30%.
My concern is about our children. So our children who already suffer from overweight or obesity, with the schools shut, they're missing incidental exercise. So even though we're going out and doing an hour walk every evening, they're missing small parts of, the 10-minute walk to school, the 10-minute little break, their big break, running between classrooms, PE, after school activities. And how do we cope with this missing exercise and increased screen time and the effects that that will have on them in the future?
There was one query that I noticed where a person has children who are living with obesity, and they were able to accommodate this extra 30 minutes into their day simply through the routine of going to school. So there might have been 10 minutes to go to the bus, and then 10 minutes when you get off the bus to go to school, and then the same coming home. Now that they're not in that routine, they don't have that exercise as part of their daily life, and therefore they're wondering, how can I get this extra 30 or 40 minutes back into my kids' lives? And it's the same answer really, which is it doesn't have to even be about walking to where the bus used to take them from. It could be going out to the back garden and just walking around. And it doesn't have to be 30 minutes in one go. It could be 10 minutes in the morning, 10 minutes around lunchtime, and 10 minutes later on in the evening. So break it up if that makes it easier for you.
My concerns are based around adolescents with living with obesity and how this has affected them between the 3 different lockdowns. They're becoming more and more afraid to leave the house because of anxiety, because of depression. And obviously this is going to have an effect long-term on their weight health, on their mental health.
This is for parents who are concerned about their teenagers' eating habits. From about the age of 10 for girls and 12 for boys, teenagers go through a very rapid period of growth and development. And after about 5 or 6 years, your teenagers will have laid down half of their adult weight, 20% of their adult height, and half of their bone mass. So they have massive appetites. Encourage your teenager to have some protein at each of the main meals. For example, at breakfast, have milk on cereal, or have yogurt or eggs. At lunchtime, cheese, eggs, fish, beans, meat, chicken, and the same at dinner. You don't have to have an awful lot, but just having some protein food at those meals helps satisfy the appetite as well as grow those bodies. And the last thing I'd say is that your teenager needs all of your support to feel good about themselves, because it's very normal for teenagers to become very anxious about how they look. Their bodies are going through an enormous change in a very short period.
Working from home can be quite difficult, especially trying to get a work-life balance with the kids being at home for homeschooling and trying to keep the same meal times every day. It's a challenge, one we just have to grow with.
Hi, I'm Sarah Brown, registered dietitian and lecturer at University College Dublin. Listening to the concerns, it's clear that working from home and schooling from home can make it more difficult to plan healthy meals for our family, and exercise associated with school can be lost for children. Work-life balance can get really blurred when everything's happening from home, and there can be high expectations to achieve everything. Planning meals at the weekend or on days where we're not so busy, although it can be an effort to get started, can be really useful. And that includes making a shopping list of the kinds of foods that we'd like our family to eat for meals and snacks. It's also worth keeping in mind that short bursts of exercise, like 10 minutes spread throughout the day, for example, before school starts or at break time, can be really useful, and then plan for longer stints on the days when we're not so busy.
Hi, my concern are the vaccines. We're getting an awful lot of what I feel is muddled information. I'd have a couple of friends and family over 70, and they're kind of figuring out what's the difference in the vaccines, that the over 70s are getting a different one. And if it comes into your area and that vaccine isn't there, are you skipped? Are you forgotten about? And why are the staff, like the frontline staff, a lot of them are refusing the vaccine? So it's vaccines I'm worried about. Thank you.
Hi, my name is Dr. Brendan O'Shea. I'm a GP working in Kildare. I work with the ICGP and also with the Clinical Advisory Group on the HSE Obesity Programme. Thanks for asking us to comment on these really interesting questions and queries. Maura's query in relation to the COVID vaccine is really topical. And Maura says she feels that we're getting muddled information. People are wondering, is there much of a difference between the vaccines and the complexities that arise from that? That if there are different vaccines being given out, how do you line up and make sure you're getting the right ones? It is confusing, Maura, okay? It's a rapidly moving situation. Many of us are of the view that there's very little real difference between the vaccines that are now coming on. They're all actually really, really good. And any of us would be really fortunate and well positioned to take up any of the vaccines. It is challenging to line up, particularly vaccines that require a second dose. But healthcare professionals in GP practices and within the HSE are working really hard. The uncertainties will become clearer. The vaccines will change. Almost certainly they'll simply get better. And I would guess that in the next year, we will see more single dose vaccines being given out. It can be exhausting, but I think it is a much better position to be in now than we were 6 or 12 months ago. Another of your queries is, are healthcare staff refusing vaccines? People in my general practice, most of us have now been immunised. Every one of us absolutely lined up to get the vaccine. I attended the Phoenix Park on a very dark Saturday afternoon. There were over 2,000 people from general practice were immunised that weekend. In my view, there are tiny numbers of people who are declining vaccines. Most people who have an opportunity to take them up so far, and especially frontline healthcare workers, are absolutely delighted to have them.
Hi, my name is Andy Hogan. I'm an immunologist with the Obesity Immunology Group at Maynooth University. I can understand the concerns I'm hearing from people living with obesity around COVID-19. Studies have shown that they're at a greater risk of more severe disease, with more hospitalizations and unfortunately more deaths. We're working hard to shed light on why this is. Our research has shown that parts of the immune system which protect us from viruses and help us fight off these invaders are negatively impacted by obesity. We don't know if this is why COVID-19 has had a greater impact on people with obesity, but it is likely. Another concern is previous research which has shown that vaccine responses are less than optimal in people with obesity. Again, we're actively working to see if obesity impacts protection to COVID-19. But now the good news. Early clinical trial data suggests that the vaccine is as effective in people living with obesity. And research from our group has shown that GLP-1 therapy is helping restore the immune system. Here at Maynooth University, we're also teaching the next generation of scientists how complex obesity is as a disease and challenging them to find the answers to the big questions.
Since Andy's recording was made, there have been several media reports of possible reduced vaccine efficacy in people with obesity. These reports were based on preliminary data, not peer-reviewed, from a small study of only 26 people with obesity. This is not sufficient information to draw any conclusion related to vaccine response in obesity. The larger vaccine studies that Andy referred to have shown good response in people with obesity.
My concern is that different articles give different information in relation to the amount of vitamin D that people living with obesity should be taking.
We know that having the right level of vitamin D in our blood is good for bone and muscle health. And we get vitamin D in our diet mainly from oily fish, eggs, meat, and some dairy products. But in Ireland, because they don't get a lot of sunlight, a lot of people have low vitamin D levels. And older people are particularly at risk because they don't get out and about in the sunshine as much. Because of this, the Department of Health has recommended that adults over the age of 65 should all take a vitamin D supplement with 15 micrograms of vitamin D per day. We don't really have any good scientific evidence that taking very high doses of vitamin D is a benefit, or that vitamin D either prevents or treats COVID-19. If you're concerned about your vitamin D levels, you can ask to have them checked during your next health checkup. It's part of a blood test. And if you are living with obesity and do have low vitamin D levels in your blood, you may need a higher dose supplement than standard to bring the levels up. So you should talk to your GP, dietitian, nurse, or endocrinologist about this. Thank you.
I had one appointment one day with the weight management clinic. And then on the same day, I had an appointment with the mental health clinic. And they couldn't be more miles apart. And that was very disconcerting because they really are connected together. Mental health and obesity are connected.
I suppose one of my concerns at the moment is my medical appointments are all done separately. There's not really a whole holistic approach to things, and I seem to have to keep relaying my entire medical history to each healthcare professional that I have to see.
My name is Neil Johnson from the Global Heart Hub, the International Alliance of Heart Patient Organisations. Many people living with obesity are comorbid with other cardiovascular conditions. A huge concern and a cause of great frustration is the siloed approach to care, both by our healthcare system and by many healthcare professionals.
It's a worry going for checkups. Women's health in particular should not be missed, especially if you've no worries or symptoms.
Hi, my name is Dr. Kiva Hartley and I'm a GP and menopause specialist. I run the Menopause Health Clinic in Dalkey, County Dublin. The last year has made a lot of people feel really frightened and scared and anxious, and we've seen a lot of fear about interacting with healthcare. And it's really important to know that if you do have symptoms that you're concerned about, or if you're due a review for your medication or your blood pressure, that you should contact your GP. They're often able to talk to you by phone, or if you do need to be seen in person, they can do this in a really safe way. Also really important to keep up to date with any screening that you might be due. So things like cervical check or breast check. Cervical check, the cervical cancer screening service in Ireland, saw only 10% of women invited for their cervical smear last year attend, and breast check have reported a drop of more than 2/3 in women attending for mammogram screening. And this is really important because cervical cancer and breast cancer are both very common cancers, and thankfully we have very effective and safe methods of screening and detecting early changes that might indicate someone is at risk.
A few weeks ago, I fell in the park, causing aggravation to the existing damage on my back. And on another occasion, I stepped out of the front door and my knee just gave under me. This has knocked my confidence.
There was two separate components of the fall. One was you're stepping out and your knee was caught at a funny angle. It kind of went from you. Another one was a totally about, I think, uneven surfaces. But the good news about that is two different things. It's just, I suppose, to normalize those experiences. From the Tilda data recently, we can tell for people in that age group from 50 to 64 have falls about 30% more than the previous age group. So it does happen. And again, the next age group on fall a wee bit more. I suppose once it's not recurrent in the same thing, I'd like to take that fear of falling off you just to normalize it, because the fear of falling is actually worse than the fall itself typically, because what happens is, as just in your story, you're concerned about all the people, the caring you've got to do for people. But now I start doing less because I'm afraid. If I start doing less, I become less able. If I become less able, I actually increase my risk of falling rather than decreasing it. So I'd encourage you to, okay, let's address some strength work around your knees to make them feel a bit stronger. Maybe do a little bit of balance work, because we know working on balance is very powerful.
After surgery, there's a honeymoon period, we all know, where we think we're never going to regain weight. But in reality, this will always be a disease we live with. And therefore, as we go along, regain becomes, for a lot of people, inevitable, even just to a small extent. But the best thing to do is to reach out and ask for help when that starts. And that's why we will always need ongoing care, because we need somebody to be able to reach out to and say, I'm having a problem, please help me.
That also applies to people who haven't gone for the surgery. Like, I never went for the surgery, as you know yourself. But I kind of felt that at the end of my year in Loughlinstown, because I hadn't gone for the surgery, that was it. You just got your 12 meetings and that was gone. And it was up to you after that.
The last year, I haven't been doing much, so it's getting sore. And then I don't do much, and then it seems to creep up. You know, it seems to escalate, right? And that's the only thing I say. And around about been after the operation, I think, like, it can very much go wrong. Like, it's not brain surgery we got. It's something to help us, a tool to get on the way to lose weight. And like you were saying there, it has to be, for the want of a better word, talk to someone about it. I'm picking up more little things now that's been said here today. It might seem like just, ships in the night, but every day you go on, you pick up something. It might only be something small, and you mightn't think of it for a week or a month, but it's there in your subconscious.
And definitely, I do think support is needed for people, not just after surgery, but anybody losing weight and trying to keep it off needs ongoing support.
Hi, my name is Mallory Noon and I'm a senior dietitian here at the Weight Management Service in Loughlinstown. And I wanted to say thank you to everyone who wrote in their concerns and address specifically the ones about support groups. I'm a real believer in support groups. I think here, especially at our weight management service, I can give lots of people tools for managing their weight differently, but those tools have to be used, they have to be sharpened, and they have to be practiced. And support networks really give you an idea of, it gives you a place to manage your emotions, receive encouragement when you're struggling, keep you accountable to your goals, or maybe even just give you inspiration for new ideas or new recipes or snacks. So I'm a big believer in setting up support networks. Your support network could be something internal. It could be a friend or a family, someone that you're going to check in with. It could also be a more national organization, so the ICPO, or maybe it's an online meeting or a chat group. Whatever it is, what I would recommend is that you structure it. So make it a specific date and time. So if it's a friend, make it a specific date and time and write it down in your diary. If it's an online meeting, then make it a priority. Set a reminder on your phone. Put a note up somewhere that you're going to see it. Make it a priority in your week to attend. This is for you and to practice your goals and keep yourself accountable. I believe that we can change the way people talk about obesity. It's not just my job to help give people tools, but also to empower you to use them.
This group is my it's my family. I haven't seen my family this time since Christmas, like, because all my family are in Dublin and I'm in Wexford. So you're my new family. I get to see you once a week, and they're a lifesaver for me, really and truly. I don't know what I did before. The COVID has good in one way because I've got to do the online groups where I couldn't drive to Loughlinstown for the meetings when you were having them once a month. So this is absolutely brilliant for me. So it's one of the good things, if we can say, that came out of COVID for me anyway.
It's kept you connected.
It's kept me connected, yeah, it really has. My husband laughs because I'd say, like, my new family. What time is your meeting today? He'd say, like, and he hides outside. He's very good, but they're brilliant for me. My mental health and my, I don't know whether it is to say, like, my craving for food as well, because my craving for meetings and sanity. So
being here and talking about it has helped a huge amount. And but the same as before there, like with the meetings here, I couldn't go to them because I'm so far away, and just being able to sit in my own sitting room and, you know what I mean, log in and speak, it's absolutely brilliant. And it is a new family, you know what I mean. That was absolutely perfect to say that, because it is.
And my job was very difficult to do because it can be very physical, and I do a lot of hands-on care and things like that. Definitely it is so much better now, because I'm so much fitter. I'm able to carry out my job like 100% more than what I ever was able to. And also people in work have commented on the difference, and my energy levels more than anything else are amazing. But I still have my bad days. I still have, days whenever I'm tired, especially whenever you've done, because I work long shifts, and some weeks, we work sometimes up to 50 hours plus, and it's just the way that our shifts fall. And you do get tired. And it used to be, if I said I was tired, people would say to me, well, if you lost a wee bit of weight, you wouldn't feel tired. But now I've lost the weight, and if I say I'm tired now, they go, oh yeah, you've been working hard. There was never the acknowledgement that I was working hard beforehand. It was always my weight was the problem.
Stigma is, it's more the unconscious bias that people have towards people who are overweight. Like, nobody's going to turn around and admit that they would treat someone who's overweight any differently in a job interview, or even being friends with them, or even dating. No one would turn around and say that, out loud, that they would be biased against someone, but people do. And I found that people are friendlier towards you after you've lost the weight, which really is a bit bizarre. Like, I'm no different at 13 stone than I was at 21 stone. You know, I think I smiled more at 21 stone than I do at 13 stone. So why would people be nicer to me when I'm a lesser weight?
So I hope that's been useful. I hope that's answered as many of the queries that have come in as possible. I wish you a very happy World Obesity Day. And as we address obesity together in the next year, remember, if you're living with obesity, you're not alone. Reach out to the ICPO or ECPO, look for the resources, and know that people understand obesity more and more. Certainly the final thing I would say is that I noticed in the queries, a lot of people are still living with stigma. A lot of people are still being judged by their friends, their family, their co-workers, by people on the street. One woman mentioned that she lost a lot of weight and she noticed people are smiling at her more. Strangers on the street smile at her more than they did before. And that's sadly because obesity has a huge amount of stigma attached to it, and people make judgments about you all the time if you're living with obesity. But that's their judgments. And don't ever let anybody else's judgment affect your understanding of who you are. Radical self-acceptance is what we preach in the obesity clinic that I work in, which is that we need to all take care of ourselves no matter our shape or our weight, and understand that no matter if we're living with obesity or not, there's a goodness in us that we should cherish and we should celebrate. So take care of yourselves, have a great World Obesity Day, and I look forward to addressing obesity together with all of you in the future.
On World Obesity Day, we, the Cree Health Team, urge everyone to address obesity together.
Because everybody needs everybody.
We are UCD Medicine, class of 2022.
On this World Obesity Day, we support addressing obesity together
and putting people first.
On World Obesity Day, it's important to remember and to recognise the need to provide timely and evidence-based care to those in society who are worst affected by the problem of obesity.